In this presentation, we're going to talk about cognitive decline. So specifically, what is part of normal aging and what might be dementia. And dementia and other diseases related to decline are a major concern for older adults and medical professionals who see older adults. One of the most important and challenging tasks is differentiating healthy aging from the beginning stages of cognitive decline. And many older adults have their own concerns about cognitive functioning. As more and more information has become available about dementia, concern has grown in family members and individuals. So we wanted to put together this presentation to help you identify normal changes that are related to aging, to understand different reasons for cognitive change, to differentiate between symptoms and risk factors for various dementias, and to identify protective factors to lower your risk of developing dementia and to identify resources for dementia. First, I want to highlight some of the particularly important brain structures and their functions before we get into change and what those changes mean. This is a very, very brief overview. I'll highlight some important structures, but this is by no means comprehensive. So both of these images on the screen are looking at the brain from the side. The first one is showing the outside of the brain, while the second one is showing the inside of the brain. The cortex of the brain, the shell, essentially, it's the very outside of the brain. It's what you're seeing on the left. It's made up of 4 lobes: the frontal lobe, the parietal lobe, the occipital lobe, and the temporal lobe. And then internally on the right, we have what's called the limbic system and the diencephalon. When our brain develops, it does so from the inside outward, starting with the diencephalon limbic system and developing outward through the cortex. So when you think about certain processes, the more primal instincts will occur in the older, more internal parts of the brain, while the more complex, higher order processes take place as you move outward. And the frontal lobes are actually the last area of the brain to develop, and they don't reach full maturity until around age 25. Each area of the brain serves its own functional purpose. However, I do want to caution that all areas of the brain communicate with each other and rely on one another for proper functioning. Still, there is some ability to break down different functions of these regions. So the diencephalon houses structures that are responsible for relay of information to autonomic functions. The limbic system plays a fundamental role in emotion, housing the amygdala. It also houses the hippocampus, which is responsible for learning and consolidation of memories. The occipital lobe is responsible for many aspects of visual processing. The parietal lobe houses the area of the brain responsible for processing bodily sensations, like touch, as well as the awareness of the body in space, perception of objects, and their spatial relationship to other objects, like spatial mapping. Additionally, the parietal lobe is responsible for some important aspects of memory. The temporal lobe is responsible for auditory processing and aspects of language. The frontal lobe plays a key role in future planning, including self-management and decision-making. People who have damage in the frontal lobe often struggle to gather information, remember previous experiences, and make decisions based on this input. Some of the many other functions the frontal lobe plays in daily functions include things like speech and language production, damage to a very specific area within the frontal lobe called the Broca's area, which helps put thoughts into words, can undermine the ability to speak, to understand language, or produce speech that makes sense. The frontal lobe is also responsible for some motor skills, for being able to compare objects, for forming memories, for understanding and reacting to the feelings of others, so vital for empathy, for personality, so things like impulse control, memory, and other tasks that help form a person's key characteristics, for reward-seeking behavior and motivation, as well as for managing attention, and including selective attention. So when this front lobe cannot properly manage attention, we see conditions like attention deficit disorder, attention deficit hyperactivity disorder as well. So there are two things I want to emphasize before we start talking about the way our brains change as we reach older adulthood as humans. So there are normal age-related changes that we expect. Almost everybody has them. And then also, our brains and cognitive functions are not isolated from our life experiences. So demographic factors and individual differences can play a big role in the way we express age-related changes. But in general, what's normal? So our brains are plastic, meaning that they continue to change based on our experiences. Normal aging includes cognitive changes, and some things change while other things don't, and it's normal. Within cognition, there are a number of domains or areas, and within these different domains, there are sub functions, and some of these things might change and other things might maintain. So to make it a little bit more clear, I want to talk about some of these domains. So intelligence. Intelligence is really a measure of general abilities or accumulated knowledge. And so one type of intelligence called crystallized knowledge is the ability or is the knowledge that we accumulate over time. And that's something that stays as we age. It doesn't change. But fluid intelligence, or our ability to solve new problems outside of things that we already know, is something that changes. And not all memory changes either, despite what we commonly think of when we think about memory and age. So our ability to recall long-term memories, that's something that stays. And I put long-term memory to differentiate between how we conceptualize this. So these are old memories that we have versus our ability to form new memories can be tougher, as is our ability to store new memories that is impacted by other factors related to age. So the things that change are new memories and long-term memories in the context of working memory. And if you have more questions about that, I would suggest watching our lecture on memory and changing in adulthood, older adulthood. With attention, we tend to be able to maintain attention when we're able to be focused on something, but what's harder is multitasking or divided attention. That changes with age. Language abilities tend to stay, so verbal abilities don't change with age, but finding words can be a little bit harder. And problem solving changes somewhat in that, like with general abilities or attention, the old way of doing things stays, but our ability to adapt to new contexts can become a little bit harder. And then lastly is processing speed, which describes how long it takes us to perform other cognitive functions. And that's something that changes. So the ability to perform tasks doesn't necessarily change, but it just might take a little bit more time. And this isn't a comprehensive list of brain health in regard to age, but it does give you an idea of what normal aging might look like and how within many of our cognitive processes, there are sub-processes that might be impacted differently with age. So cognitive change can also occur as a result of disease, like dementia, but it can also occur as a result of a number of external or internal factors that we often don't think about. So again, we should expect some changes to occur with normal aging. There's structural brain changes that occur, and there's also just the expected changes that we tend to see that occur within different stages of aging. But then there's also things like medications, which might have cognitive side effects. So pain medications Benadryl, or other various prescription drugs might have different unwanted side effects. And with age, we become more vulnerable to medical conditions, which increase the likelihood of having medications, which may have an impact on our cognitive abilities. We also experience changes in sensory systems. Like we're not able to hear or see quite as well as we used to, and that can impact our ability to learn and subsequently remember things. We also might experience different health concerns. So anything like chronic pain might affect our ability to concentrate on things. And it's a little bit of a chain here. If we can't concentrate on something, we can't learn something, and then we can't remember it. In regard to mood and mental health, these can also play a role in our cognitive abilities. We're more likely to recall mood congruent information. So if we're in a positive mood, we're more likely to remember positive information. But we're also just more likely to attend to negative stimuli as well, which is just a natural bias that our brain has. With anxiety, people tend to experience selective attention, and with depression, there's also just impaired attention in general. But then there are also pathological changes, like unmanaged conditions like diabetes can lead to other concerns, cardiovascular disease as well, and even these dementias. So when we talk about cognitive impairment and dementia, it can present in a couple different ways. So cognitive impairment can be progressive, non-progressive, or reversible. The progressive cognitive impairment would describe things like the dementias and Alzheimer's disease, so things that progressively get worse over time. They can also be non-progressive. So if somebody were to experience a stroke or a traumatic brain injury, which happens when we have trauma to our head, that's something that we don't expect to get worse over time. It's just a single event that causes cognitive impairment. And then there's also cognitive impairment that's reversible. So some medical conditions, depression or anxiety, or medication side effects, if we were to stop taking those medications or treat depression or anxiety, cognitive impairment might reverse back to normal. And there's also a number of factors that put us at a higher risk for non-normal cognitive changes. There's a genetic component. There's health conditions like heart disease, stroke, high blood pressure, diabetes, or sleep problems. Like I said, there's some medications or the improper use of medications. There's also things like alcohol or smoking. Smoking increases our risk for experiencing vascular concerns. And then heavy drinking for a long time can also cause brain damage. You can have an alcohol-induced form of a dementia. There's also accidents. So as we age, we're at an increased risk of experiencing falls or accidents, which put us at an increased risk for experiencing head injury. So let's talk about mild cognitive impairment, or an MCI. An MCI is a greater decline in cognition than we'd expect, but not quite meeting dementia criteria. So MCI is not a normal aging process. Instead, it's sometimes the early detection of a pathological disease process. And it's hard to determine the rate or prevalence at which MCI are occurring because there's so much variation across demographics and across diagnostic criteria, or people not seeking medical support. So MCI can look a little bit different depending on how it's diagnosed, depending on the individual. But what's important to know is that the reason an MCI might occur within an individual can vary dramatically. So the most common thought of the type of impairment in aging is degenerative. So when you think of a degenerative disease, you think of diseases like Alzheimer's. And these are impairments that will continue to progress and worsen as time passes. An MCI might be a predictor of this. Vascular MCIs are related to problematic blood flow in the brain. So MCI in this case would be associated with a decreased or blocked blood flow to the brain. And the way it looks or the severity might have to do with the vascular event that took place. Psychiatric MCIs can be related to severe psychological symptoms, like very high levels of depression, which might reduce processing speed or attention. And this type of MCI can be improved somewhat with the treatment of the psychiatric symptoms. There can also be traumatic MCIs due to trauma to the brain, so like a brain injury. And without repeated insults or repeated head trauma, these MCIs can improve or remain stable over time. But they do put individuals at a greater risk for further decline if head injury continues to occur. What to take away here is that MCIs can be diagnosed and then revert to normal. They might remain stable or they might continue to progress. Outcome is largely dependent on individual factors and environment at the time of testing, though, too. So before we talk about a couple different types of dementia, it's important to know what dementia means. So dementia is the name of a set of symptoms that include memory loss and thinking difficulties, as well as with problem solving and language. So it's really an umbrella term that's used to describe a range of symptoms associated with cognitive impairment. So the rate and the type of dementia varies widely. So there's a lot of information here, but there's also a lot of different types of dementias. And so these are the four that we're talking about today. They're commonly discussed, these being frontotemporal dementia, dementia with Lewy bodies, Alzheimer's disease, and vascular dementia. So frontotemporal dementia is one of the less common types of dementia. Frontotemporal is referring to the lobes of the brain that are damaged in this type of dementia, fronto being the front and temporal being on the sides. The frontal lobes of the brain, found behind the forehead, deal with behavior, problem solving, planning, and the control of emotions. There's also an area, usually in the left frontal lobe, that controls speech. The temporal lobes on either side of the brain have several roles. The left temporal lobe typically deals with meaning of words and the names of objects, while on the right side, it's usually involved in recognizing faces and familiar objects. So symptoms of frontotemporal dementia include changes in personality and behavior and difficulties with language. These symptoms are different from the memory loss that's often associated with more common types of dementia, like Alzheimer's disease. This is a significant cause of dementia in younger people, being individuals under the age of 65. And frontotemporal dementia is probably the third most common cause of dementia in this age group, possibly even the second most, but there's some inconsistencies in what studies are reporting. And it's thought to, or it's been shown to affect men and women roughly the same. Dementia with Lewy bodies is a type of dementia that shares symptoms with both Alzheimer's disease and Parkinson's disease. It is thought to account for 10 to 15% of dementia cases and is often mistaken for Alzheimer's disease. So Lewy bodies are tiny deposits of protein that appear in nerve cells in the brain. And while not a lot is known about them, researchers do know that they contribute to low levels of important chemicals that carry messages between nerve cells, as well as a loss of connection between nerve cells, which then die. So the way someone is affected by dementia with Lewy bodies will depend partly on where the Lewy bodies are in the brain. So Lewy bodies at the base of the brain are more closely linked to problems with movement, like motor symptoms, which are the main features of Parkinson's disease. But then Lewy bodies that are found in the outer layers of the brain are linked to problems with mental abilities, so more in the cognitive symptom realm, which is a feature of dementia with Lewy bodies and Alzheimer's. Alzheimer's disease is probably, no, it definitely is the most common cause of dementia, accounting for 60 to 80% of dementia cases. And in Alzheimer's disease, connections between nerve cells are lost as proteins build up and form abnormal structures called plaques and tangles. Eventually, nerve cells die and brain tissue is lost. Less of some chemical messengers in the brain So there are less of certain chemical messengers in the brain. So the signals are not passed on quite as well between nerve cells. There are some drug treatments available for Alzheimer's disease that can help boost levels of these chemical messengers that can help with some of the symptoms. But Alzheimer's disease is a progressive disease, meaning that gradually over time, more parts of the brain are damaged. And as this happens, more symptoms develop and they also get worse. Hallmarks of Alzheimer's disease include progressive memory impairments and a term called sundowning. And this term, sundowning, refers to a state of confusion that occurs in the late afternoon, moving into the night. So if you were to imagine having limited cognitive resources and using them up during the day, by the time you get to the late afternoon and evening, there's just not quite as many cognitive resources left, and confusion and cognitive impairment come on a little bit more strong. Lastly is vascular dementia, which is the second most common type of dementia. Vascular dementia is caused by reduced blood flow and blood supply to the brain due to diseased blood vessels. So to be healthy and function properly, brain cells need a constant supply of blood to bring oxygen and nutrients. The vascular system is the body system of vessels that brings blood to the brain. And if the vascular system within the brain becomes damaged, so that blood vessels leak or become blocked, then blood cannot reach the brain cells and they will eventually die. So this can be related to stroke, to blood clots, or to vascular disease. And this death of brain cells can cause problems with memory, thinking, or reasoning. Together, these three elements are known as cognition. So when these cognitive problems are bad enough to have a significant impact on one's daily life, these cognitive impairments are what make up vascular dementia. So you can see that although these are all types of dementia, they have distinct characteristics from each other. So other notable symptoms, so things to keep an eye out for in loved ones if you're concerned about them, would be if they ask the same question over and over again, if they're getting lost in familiar places or not able to follow instructions anymore, if they're easily confused about time, people, and places, or lose things often, if they're forgetting important events or appointments, or they're having a really hard time finding the right words at a significant rate that's different than other people at their age or an education level, and if these difficulties get worse at night. And like dementia, normal changes with age can still disrupt life and are still very valid concerns. For example, with age, you might notice changes in memory for a number of reasons. So declines in the hippocampus, which is part of the limbic system, is related to difficulties with episodic memory or everyday memory. Declines in the prefrontal cortex are associated with source memory, which is our ability to recall something specific that we've learned. Declines in prefrontal cortex is also associated with impulsivity and inhibition, all of which are associated with declines in the amount of dopamine receptors. Inhibition is present in the ability to filter out unimportant information in the environment and attend to what's important. And this can impact memory as well. So all of these cognitive functions are changing. I guess some of these cognitive functions are changing with age, but they all do relate to each other. What does this mean? When we consider older adults and structural changes and subsequent functional declines, we see some of these in testing settings. However, the majority of these declines are accounted for by having the data norms specifically for older adults. So this is in regard to testing. As well, a lot of these declines don't show up prominently unless a task is particularly difficult or stressful. So these changes do create a greater susceptibility of emotional distraction and interfering during tasks. So we can tell by using specific tests and specific tasks in a testing environment how much of a of a change that an older adult is experiencing is normal being compared to their peers versus something that we don't expect. So one particular impact of these declines that underlies every process is disruptive attentional control. But in everyday settings, it might mean that we just need to rely on compensatory skills more than we did before, which isn't a bad thing at all. So that might be things like calendars and reminders, or setting yourself up for cues. So leaving your medicine in a place where you will easily see it in the morning or evening or whenever you're taking it. Or working in a quiet environment for better concentration. Or giving yourself more time to remember, to solve problems, to slow down, as well as asking your partner to help you remember. There are some protective factors to note as well, though. So things that lower your risk of experiencing non-normal cognitive decline. Education has a relationship with cognitive functioning and protects against cognitive decline. So you'll find that there's a dramatic increase in the protection from 0 years of education to even 1 year of education. But as the numbers of as the years of education increases, the amount of protection is not quite as much. So adding 1 year of education can definitely help you, but the more years of education you have, the less it will help you. Diet and exercise have also been linked as two of the most prominent factors in generating new neuronal growth and protecting against further cognitive decline. It's also important to get regularly screened for conditions that impact overall wellness and brain health, especially when we talk about vascular health, because we know how much untreated vascular disease, cardiac disease, and things like that can impact brain health. And then also social connection. We know social connection is a huge protective factor against psychological distress, as well as against cognitive decline. That's what we have for you today on normal aging versus dementia. So just looking a little bit more at what normal aging is. If you have any follow-up questions, please feel free to comment or email us here at pacific.memri.clinic@gmail.com. Some of the references we used to create this presentation are listed here if you want to follow up on any of these.